My name is Keishana Jones. I go by KJ. Today we'll be talking about hypertension, cause and effect, prevalence, comorbidities, prevalence, things we can do to reduce, diet, physical activity, and all sorts of things, okay? I'm currently RN here in Huntsville, Alabama. I work on the behavioral health unit, and I'm also in the BSN program at Athens State. Before I dive into this presentation, do you guys mind me recording y'all? This may go public, so if you guys give me consent, shake your head yes or no, or say yes. Yes. Okay. All right, so before we get started with this presentation, on the board it says, hi, my name is KJ. We are going to talk about hypertension. Okay, so like I said, before we dive in and get started, I'm going to give you guys some handouts. They're going to be on this bright orange brochure, and it gives us that information about, like I said, hypertension, the things I just previously talked about, stated the main objectives, and then it's going to give us, there's a diet that says DASH. We're going to talk about what DASH is. There's also a physical exercise sheet that I'm going to give you guys as well. And then the last thing that I will give y'all will be the evaluation. So I have not given y'all that yet, but it's going to be like an evaluation tool just for me to reflect on how I did my presentation, if you guys took anything from it, so if you can answer that truthfully towards the end whenever we complete this presentation, okay? Let's jump into, so let's talk about the main goals. The main goal of this program is for me to educate you guys in the community about hypertension. Just so you guys have some knowledge, and then I just would like for y'all to spread that with your close family, your distant family, however, whoever you can get to, so that we can reduce the possible deaths and injuries that it leads to, because hypertension does kill, and it's kind of like a silent killer. Also, they cause CVA, strokes, heart disease. Like it's a main factor in a whole lot of heart diseases, okay? CAD, like it is very important. So let's jump into what is blood pressure, the main thing. All right, so blood pressure indicates how hard your heart is working to move blood throughout your body. We read the number systolic, which is usually the higher number, and then diastolic, which is the lower number. So we read it as the normal blood pressure would be 120/80 for, I'm 28 years old, so this is what I will be looking for in a blood pressure. If your blood pressure, an elevated blood pressure, I would say, since I've been a nurse, anything over 175. I take that very seriously, and we try to give some type of medicine, and usually on our PRNs that a lot of our medical patients have, anything over 180, you would give them hydrolysine, okay? And then recheck after a 30 minutes, 15 to 30 minutes, okay? The reading is divided into two numbers, which I just said, the systolic and diastolic. The first number is systolic, and then the second number is diastolic. Things to check how could you check your blood pressure? So this generation is new, so we have automatic blood pressure cuffs. Usually in the hospital, nursing homes, any type of facility, they usually have the automatic. A lot of doctors' offices have the manual, where they just put it on your arm and then they squeeze to inflate, and then we'll use a stethoscope to hear the beats, okay? And then they also have those portable ones, which some people do offer them and give them out. You can buy them from CVS for like 20 bucks. They get on your arms. We make sure that we're not crossing our legs, sitting down, being still, so that it can detect accurately. And it goes on your arm, and then it reads, just like it would do, on your wrist, and then just like it would do on your arm. All right. So one of our main things that we're going to talk about is what may cause high blood pressure or hypertension. So we said poor diet, and we're going to go over our handout that I'm going to give y'all, and it's going to look like, let's see if I have it in here. We're going to talk about it here in a second, but we're going to talk about the DASH eating plan. And also in the handout that I gave y'all, have some on the back. She has some meal plans that we're going to talk about. So poor diet. So let's try to stay away from anything salty, high in fats, things of that nature if you have high blood pressure. We're also going to talk about being overweight or being obese, which is where the physical activity ties in. You want to kind of get that physical activity in to keep that blood pressure stable. Lack of exercise ties in, I told you. Diabetes, another thing. Some people, it just runs in their family, you know, and then diabetes ties into, can lead to high blood pressure as well. Extra sugar in the bloodstream can damage kidneys or make blood vessels less elastic. Kidney problems and hormone problems. Family history, if you have high blood pressure in your family. Race, African Americans are more prevalent to get high blood pressure. Sometimes it just runs in their family, and it just falls in. They could probably be healthy, things of that nature, but sometimes it's just like a genetic thing. And then excessive alcohol consumption and smoking. Those play a big factor. Those play a very important role in that. So we will talk about smoking cessation, decreasing alcohol intake, and things of that nature to prevent hypertension. All right, so now that we have talked about the factors that cause high blood pressure or hypertension, we're going to recap on that. So we say poor diet, being obese, aging, poor activity or exercise levels, diabetes, chronic conditions, family history, something that you really can't help, race, and excessive alcohol and nicotine consumption. All right, so now, I spoke earlier on it being the silent killer. And we say that because most of the time there are no obvious symptoms. I've had patients that had no symptoms. Symptoms that people with high blood pressure may exhibit would be sweating, chills, headaches, being numb on either side, things of that nature, that which could lead to a TIA, which is like a mini stroke. The best way to protect yourself is to visit your primary care provider for checkups and to follow their instructions. It is also important to understand that the causes and the consequences of high blood pressure so you can slow down or stop the progression. Increased stress and anxiety may temporarily rise your blood pressure by causing your heart to beat faster and your blood vessels to narrow, but it doesn't cause chronic high blood pressure. So a lot of times people that are stressed, that has been arguing, screaming, hollering, their blood pressure tends to rise because they're stressed out. It does this to the blood pressure. So it does that to the blood vessels, and it increases the blood pressure. So those are, that's why they call it the silent killer. All right, so now, how can I manage or treat high blood pressure? So we take the medication that's prescribed, and we tell all our patients here, I work on the psych unit, do not stop because you think you feel better or you think you are better. Your blood pressure will run high. It does not matter what you do, because now that you've been taking that medicine, your body is, it's been regulating with that medicine. So when you stop taking it, that's what it's going to do. And you could be literally in the bed, sitting up, doing nothing, just watching TV, and your blood pressure is running like 190 over 100. And people are like, well, that's baseline for me. Well, that's not good. That's not healthy at all, okay? So let's try not to do that. So when you see your PCP regularly, if you do have hypertension and you smoke, you need to stop smoking. You need to try to use a nicotine patch, something to wean you off from that smoking, okay? Eat a diet high in fresh fruits and vegetables, low fat, I spoke on that earlier, and reduce saturated and total fats. Read food labels to choose foods that are low in sodium. Sodium plays a big role in that, okay? Alright, so we said if you're smoking, stop smoking. Eat a diet high in fresh fruits and vegetables, low-fat dairy products, and reduce saturated and total fats. We want to be low on sodium. Sodium is going to rise up your blood pressure, so we have to stay away from salt, okay? Physical activity, at least 120 minutes per week. I don't care if you are doing it at home. You do not have to go to the gym. Doing something and being physical, even if that means you just go to work and get your walks in at work, that's fine. I feel like I get my steps in at work all the time. If you drink alcohol, do so only in moderation. I feel like wine here, 2 or 3 times a week, wine. I'm not saying a whole bottle, but I am saying if, smoking just for social, not just because you want to drink every day. That's not good. That is going to rise your blood pressure or put you in that factor to have high blood pressure, okay? Manage stress by just practicing deep breathing, finding different ways to cope when things are happening. Just overall, just manage your stress. People have do different things for different situations. But if you don't, we're gonna talk about the consequences, okay? So, what do you guys think can happen if you do not control your blood pressure? I want to hear some answers if you don't mind. So, all right. Gotcha, CVA. Main one, too. Or, as I spoke earlier, TIA. Usually start here first as a TIA. Then we go down. We can say CAD. It can cause you to have fluid retention. There's a lot of things. All these are not deadly, but some can lead to that. Okay? All right, so also, I heard a second ago, PAD, peripheral artery disease. Okay, the biggest one, heart attack, which is basically the same thing as this. Honestly, if we're being honest, same thing. So let's talk about it. So some of the consequences of not getting your blood pressure, your hypertension treated, PAD, it narrows the arteries, having a stroke or TIA, it damages the blood vessels, it ruptures or forms clots that travel to the brain. Having the stroke can leave permanent damage. It's not as bad as a heart attack, but you could be not functioning on, depending on what side you have the stroke on, it can lead the opposite side to be non-functional or have to learn how to redo everything, or just permanently damaged. So it really just depends. Eye disease, it can cause loss of vision due to damaged blood vessels. A heart attack, we spoke on that. Congestive heart failure, that is the big one, which kind of tunes in with fluid retention. We kind of want to, that leads to the CHF, okay? And then chronic kidney disease, when we spoke on that earlier. The conditions that may increase blood pressure are, so y'all can kind of see what I'm doing here, are chronic kidney disease. And people sometimes ask how those interact. They play a major role. So usually when you see people with chronic kidney disease, they also have some type of heart problems, or vice versa. All right. Being overweight or obese plays a big role too. So obesity, and then obstructive sleep apnea. So, and these are the people that sleep with a CPAP, and they usually stop breathing at night when they're sleeping. So those can increase your blood pressure, okay? Good. All right. So I'll give you guys time to look over all the rest of the things in the brochure. And then we're going to talk about the DASH eating plan. And it's going to be the part of the brochure that looks like this. And it's not, well, let y'all see, sorry. It's not going to look like this big. It's going to be kind of smaller on you guys' end because of because of how it was printed on that one brochure. Sorry. So, let's talk about DASH. What do you guys think that DASH stands for? Any guesses? Y'all don't have to shine as we go. Okay, so, and y'all may not know because I didn't know, but it was a cool way to kind of remember this to prevent hypertension when you are eating or deciding your meals or meal prepping if you have to. So, dash dietary approaches to stop hypertension. Okay, so see that? Dietary approach to stop hypertension. Let's see if I can maybe zoom it in. Yeah, sorry. But, so eating nutritious food will help you control your blood pressure. The DASH diet emphasizes fruits and vegetables, low-fat milk products, and whole grain. It's the Mediterranean diets of full nutrients that are good for your heart and good for your health. This eating plan is for 1,800 calories per day. The sample menu of the following page is based on this plan. So we'll look at this plan meal. So it says vegetables, having 4 to 5 servings per day, which includes leafy greens, chopped raw or cooked vegetables, or vegetable juice. Then we have fruits, about 4 fruits a day, 1 medium fruit, half cup of fresh fruit or frozen or canned. Grains, 1 slice of bread, 1 cup of dry cereal, half a cup of cooked rice or pasta. 1% fat or non-fat milk, 1 cup of milk or yogurt, or 1.5 ounce of cheese. Poultry, fish, lean meats, 1 ounce cooked meat, poultry, or fish. Beans, nuts, and seeds, 4 per week. And there's just like a different kinds, a certain size, and examples, and it goes on. And you can see on your sheet here, and then you can kind of just use this to basically make your own meals, because everybody doesn't eat the same thing. I like some things like Brussels sprouts. I don't like those. I wouldn't want to eat those with my meals, so I would just sub that out for something else. And we can do spinach or broccoli. I like those. So you can kind of just base this off and get you like 2 greens or 1 green, 1 grain, and then and you can kind of do this, base this off breakfast, lunch, and dinner, and your snacks to kind of keep a healthy diet, okay, and to stop hypertension. And it gives you examples, like I said, breakfast, morning snack, lunch, afternoon snack, and dinner on the sheets bar, on the small corner. Y'all are in boxes. So, like I said, this is where do I start? First, write down everything that you eat a day, and then compare your meals to the DASH meals. So and then it says try to sub out the unhealthy things with the DASH recommendations. And there shows you a DASH eating plan. And it also gives you different serving sizes to try to, so you can plan your meals. All right, so now we are at food and physical activity checklist. And basically the food is what we already went over. We talked about it gives you more of a checklist of what you could eat every day and what you shouldn't eat every day. And it's going to show you pictures on y'all. It's probably going to be on the back. And then it's going to give you an activity checklist to play. So you can play active games, follow the kids to school every day, be physicals, take the stairs. I take the stairs every day, not the elevator. I get my steps in, I promise you. Help kids be physically active for at least 60 minutes per day, or most days. And then it says you can write your own ideas, okay? And then it gives you like on this picture you guys see where it says braised chicken thighs with spinach. If you don't like spinach, sub it out for broccoli or spinach. If you don't like spinach, sub it out for broccoli. If you don't like broccoli, sub it out for asparagus. If you don't like rice, sub it out for pasta. Okay? If you don't like chicken, sub it out for some fish. Anything would work, as long as we stay on that low sodium, low fat side of the diet. Okay? All right, so I'll let you guys continue to look over that for a second. Okay, so before we wrap this up, let's talk about the main key points that we talked about today. So we're just kind of going to do a recap. Consequences. Remember, consequences of this: CAD, PAD, heart attack, eye loss, eye vision loss, congestive heart failure, things of that nature. How to treat and manage it: physical activity, diet, smoking, decrease of smoking and drinking alcohol. What conditions can increase hypertension? All of those that I just said, if you do not control it or decrease it, okay? All right, so if you guys don't do anything, I want you guys to take away those things. If you guys don't remember the causes or this, that, and third, remember that it can cause death. It can eventually lead to injury or death. Things that we do not want. Sometimes things that cannot be reversed. So I suggest you guys to take hypertension very serious. And then sometimes you're like, okay, well, I don't think I'm getting it. I'm young. I'm just gonna eat whatever I want to. I'm working on that because I'm getting older, and I have to learn how to season my food appropriately because I will over season. Okay, that is true. All right, just spread it to your family. Spread it worldwide if you can. If you have to share this video, share this video. All right. So now, you guys, we are going to do the evaluation. If you can answer this evaluation as truthful as possible with the questions, and you don't have to share any answers, just flip it over, and you can sit it here on this little stack.
All right, so this last piece of paper is an evaluation tool. If y'all can fill it out and give it back to me, okay?
Thank y'all so much for participating for me in this presentation for school. It's greatly appreciated. And if you guys don't mind to be in my next one or whenever I do presentation, I would love for y'all to participate. Thank you. Y'all have a good day. Bye.